Hello, in this video we are going to learn about bronchopulmonary segment. You know bronchopulmonary segment. What do you mean by bronchopulmonary segment? Bronchopulmonary segments are the well-defined sectors of lung which are aerated by tertiary bronchi. So that's individual segments, surgical segments are known as the bronchopulmonary segments. Okay, so there are some characteristic features of the bronchopulmonary segments. There are 10 segments in each lungs. 10 segments in each lung. They are pyramidal in shape, and their apex of the pyramid, apex is directed towards hilum. Okay, and they are surrounded by connective tissue, and each lobe is independent. I told you, each lobe has its own artery, bronchus, lymphatic, drainage, everything. Okay, and so these are the features of bronchopulmonary segment. Now let us draw the bronchopulmonary segment. Okay, start with the right lung. So here is the right lung, very easy. Okay, let us draw the right lung. This is the right lung. Is the right lung. Okay, you know the right lung has got how many lobes are there? 3 lobes are there, right? 3 lobes are there. You know, this is the apical lobe or the upper lobe, superior lobe, middle lobe and inferior lobe. Here superior, middle and inferior. Okay, now let us draw the bronchopulmonary segment. Okay, at the superior lobe there are 3 segments are there. Okay, let us make a Y there, and just draw a Y here. Okay, 3 are there. This is the apical. Okay, you know, this is the anterior border of the lung, this is apex, this is a posterior border, and this is the base of the lung. Okay, so first one is apical, then this is the anterior, here comes posterior, anterior and posterior, 3 are there. Okay, let us write here. You know, the right lung has got 3 lobes are there, superior, then middle and inferior. Then superior has how many are there? 1, 2, 3. What are they? One is apical, next one is anterior, third one is posterior segment. 3 segments are there. Segment. Then come to the middle. Where is the middle one? This is the middle one, right? So middle has got 2 segments are there. Okay, let us draw them here like this. Okay, the one is, this is the medial, this is the lateral. So we can write, this is the fourth one is medial and the fifth one is lateral. Okay, now coming to the inferior lobe. Inferior lobe, how to draw? Let's make a line over here, like this. Then the lower one is 1 to 3. Okay, the one which is above, that is a superior. Okay, let us draw the sixth one is superior. Okay, then this is the anterior basal, posterior basal, lateral basal. Okay, 7 is superior, anterior basal, 8th one is posterior basal, 9th one is lateral basal. Then total how many are there? 10. Where is other one? One is missing. No, this is the lateral aspect of the lung, lateral surface. So the 10th one is the medial basal. Medial basal. Where you can see the medial basal? On the medial aspect. On the medial aspect. So now we have drawn the 10 segments of the right lung. Okay, now let us draw the left lung. So here is the left lung. Let us draw it. Here is the left lung. See, here it is. Here is left lung, and your left lung has how many lobes are there? 2 lobes are there, right? So here is the 2 lobes. Okay, we have how many lobes are there? 2 lobes are there. What are they? Superior and inferior. Superior and inferior. Okay, the superior part. Okay, now let us draw the bronchopulmonary segment. If you see superior part, just draw a line like this. Okay, and this upper portion is divided into 3, just like the right lung. So here one's superior. This is the anterior border. Okay, here comes the anterior. Here is the posterior. Let us write here. The first one is superior. Second one is anterior. Third one is posterior. And see, some portions is remaining there. Okay, so that we can divide it like this. 2 segments here is there. That is the superior lingual. This is the lingula. So here is the superior lingual and inferior lingual. So here 4, 5. So 5 superior lingual, inferior lingual. Okay, then coming to this next one, this is the inferior lobe. Inferior lobe is same like that of the right lung. Okay, how we can draw? Just draw like this. Then here we have 3. Okay, and the name is same. Here comes superior, anterior basal, posterior basal, lateral basal. Okay, let us write. 6th one is superior, 7th one is anterior basal, 8th one is lateral basal, then come the posterior basal, and the last one is the medial basal. Medial basal. Now let us draw the bronchopulmonary segment. The first one is the right lung. Okay, now let us draw the right lung. So here is a right lung. Let's draw it. Easy. Right lung. Okay, right lung has or how many lobes are there? 3 lobes are there, right? Like this. 3 lobes are there. Sorry. Now let us draw the bronchopulmonary segment of the right lung. Okay, so here it is. Now let us draw the right lung. Here's a right lung. Okay, and right lung has got 3 lobes are there. 3 lobes are there. Okay, what are they? This is superior, middle and inferior. Let us write there. Superior, middle and inferior. Okay, and now let us draw the bronchopulmonary segment. See, the superior lobe, 3 surgical segments are there. Let's draw like this. So this is the superior. This is the anterior border of the lung, apex, base and posterior border, remember. Okay, now this is the anterior segment, this is the posterior segment. Okay, now we have 3 on the superior. First one is the apical. Number 1 is apical, number 2 is posterior, number 3 is anterior. Okay, now coming to the middle lobe. Okay, middle lobe has got two segments are there. Two segments are there. It's like this. There is a medial and lateral. Medial and lateral. Okay, so we are having 4 and 5 here. Fourth number is lateral and the fifth number is medial. Okay, remaining will be there 6, 7, 8, 9 and 10. Okay, now see this inferior lobe, let us divide like this into 3. Okay, so this is superior, this is anterior basal, posterior basal, then we have the lateral basal. Okay, sixth one is superior. Sixth one is superior. Then eighth one is anterior basal. Anterior basal. Ninth one is lateral basal. And the 10th one is posterior basal. One is remaining, that is the medial basal. See, I did not draw the medial basal here because this is the lateral aspect of the right lung. Okay, so medial basal is present on the medial aspect. Okay, so these are the bronchopulmonary segments of the right lung. Now let us draw the bronchopulmonary segment of the left lung. Left lung. Okay, now let us draw the left lung. Here it is. Left lung, and you know the left lung has got 2 lobes are there. It is like this. This is apical or superior, inferior, superior and inferior. Okay, let us write superior and inferior. Okay, the superior lobe of the left lung. Okay, how many we get? 5 surgical segments. 5 surgical segments. Okay, let us draw this one. Very easy. Okay, so you can make a line from here. See, make a line over here. Then upper area and the lower area. Upper portion and lower portion. Okay, in the upper portion you just make Y the same like that of the right lung. So we get superior. This is anterior. This is posterior. This is the anterior border of the lung. This is the posterior border of the lung. Okay, posterior border, anterior border. Okay, so upper lobe we already got 3. 1, 2, 3. Okay, first one is apical, then comes a posterior, then comes the anterior. 2 more remaining, 4 and 5. Okay, you know this is a lingula of the left lung. Lingula of the left lung. Okay, just make a division over here. So we are getting 2 superior lingual, inferior lingual, superior lingual and inferior lingual. The fourth number is superior lingual. Next one is inferior lingual. Okay, so these are the bronchopulmonary segments of the superior lobe of the left lung. Now let us see the inferior lobe of the left lung. So total 5 are there. 6, 7, 8, 9 and 10. Let us see what are they. Same here, this the inferior lobe is same like that of the right lung. Okay, so what you do, just to make section over here, line there, then divide into 3. This is superior, you get anterior basal, posterior basal, lateral basal. Okay, and where you can see the medial basal is on the medial aspect. Sixth number is superior. 7, it was same, medial basal. 8th one is anterior basal. 9th one is lateral basal, and the 10th one is posterior basal. This is same like that of this one only. See, it is very easy. Hope you understood. Now you need to draw one more diagram for the bronchopulmonary segment. Okay, let us draw that also. Listen, like this. Okay, here it is. A. Okay, now here let's draw a vein. This is a vein. Okay, this vein is known as the intersegmental vein. Okay, so this is a bronchopulmonary segment. One bronchopulmonary segment. This is another bronchopulmonary up to here. Okay, between two bronchopulmonary segment there is a vein. Here also the same vein, intersegmental vein. You know, so here also you can see the intersegmental vein is there, and this area is the bronchopulmonary segment. You know, bronchopulmonary segment has its own artery, vein, and bronchus. Okay, let us draw these three structures. Okay, so we have the bronchus. First let's draw the bronchus. So here we have a bronchus. Here bronchus. Okay, and there is bronchial vessels are there. We have a bronchial artery here. This is a bronchial artery. Then you get, this is a bronchial vein, and there is a bronchial artery. This is a bronchial artery. This is a bronchial vein. This is a bronchial artery. This is a bronchus. Okay. In addition, we are having one more structure, that is the pulmonary artery. We have a pulmonary artery over there. Here is the pulmonary artery. It supplies this pulmonary artery. The same structure is present over here also. Whatever the structure present over here, it is present over here also. Okay, so this is the bronchopulmonary segment. Okay, and what is the importance of this bronchopulmonary segment? What is the importance of the bronchopulmonary segment? There is something called segmental resection of lung. Segmental resection of lung. For example, so if there is an infection in this bronchopulmonary segment, the surgeon need to separate or to dissect over this particular bronchopulmonary segment. And how he locate the bronchopulmonary segment? So he locates the bronchopulmonary segment by tracing the intersegmental vein. Intersegmental vein. So intersegmental vein. That is the importance of the intersegmental. That means if we follow this intersegmental vein, okay, two intersegmental vein, in between the two intersegmental vein there is a particular bronchopulmonary segment. Okay, hope you understood the topic. If you find this video useful, please share it with your friends. Thank you.